Good afternoon, everyone. We're going to get started. My name is Ben Weigel. My pronouns are he, him, his. I'm one of the residents at Baylor College of Medicine in Houston. I'm joined today by many of my wonderful faculty and one of my co-residents. And I'll be introducing everyone in a moment. But we'll first go through some definitions and a discussion of our format for this didactic. So I'd like to start by acknowledging that people have a different base of knowledge on this subject, and that's okay. We're going to be starting with the basics, and those that have more knowledge should share. So we're going to start by defining diversity. I think there are many different ways to define diversity, but really if we boil down to kind of the most simple definition, it comes down to having multiple identities represented within an organization. And we're going to kind of drill down on two of these groups of identities for our didactic today. So to start, I'd like to define this term URIM, which stands for Underrepresented in Medicine. This refers to racial or ethnic populations that are underrepresented in the medical field relative to their numbers in the general population. And this lens currently includes students who identify as African American or Black, Hispanic, Latinx, Native American, or Pacific Islander. The other term we'll be using is this term SGM, which refers to sexual and gender minorities. That includes individuals who identify as lesbian, gay, bisexual, transgender, queer, or intersex. And so, why are we here today? Why are we talking about this? Why is diversity important to the ACGME? I think that this could be a whole lecture in itself. And really the point of this is to get everyone interacting with each other. So basically what I'll say is diversity in the physician workforce, we know that it improves healthcare access. We know that it improves patient outcomes. And as providers, improves cultural humility for our patients. This is the format for today's didactic. So after this brief introduction, we'll be dividing up into 3 small groups for discussion, and that's going to be about 20 minutes. Then we'll come back together for a large group discussion, followed by conclusion and a question and answer section. So here are today's facilitators. We're going to be dividing, as I said, into 3 groups. The third group will be on the next slide. And we're going to be discussing, each of these groups will have different kind of topic. Group 1 will be discussing challenges and strategies that occur prior to applicants arriving for the actual interview day. And that will be led by Drs. Adeshina and Dr. Wilson. The next group is going to be a group with 4 facilitators. We'll be discussing challenges and strategies that folks may encounter when applicants are specifically at their site or during the actual interview day. The facilitators for that group will be Drs. Tichter, Sakon, Turner, and myself. And then lastly, we'll have a post-interview challenges and strategies group, which will be led by Drs. Ordonez and Thomas. And then once we have those groups kind of wrap up after a period of about 20 minutes, we're going to come back together for a large group discussion, which will be led by Dr. Bezick.